So one of the things that we know about healthcare when it's provided in a collaborative fashion is that benefits not only patients because they're able to have higher quality care, they're able to have more responsive care, they're able to see that the different healthcare providers that they're working with who are providing for their health and their well-being are talking to each other, learning from each other, that they're incorporating what each other is doing as that individual healthcare provider is working with the patient. That makes patients feel more comfortable. It gives them greater confidence in the care that they're being provided, and it gets them more invested and engaged in their own health care, which is, of course, important as well.
And it should look like doctors and nurses and other healthcare professionals and pharmacists and social workers all talking to each other about a patient or a client and their situation, their treatment, things that they need in order to help them get through whatever it is they're going through.
And what's happening now, we're finding out that patients are being healthier if we all collaborate together and we all work together. So you're going to see a lot of other professions coming together to work as a team for the benefit of that patient. And that's what interprofessional education and interprofessional collaboration is all about.
I think there's an analogy to building a house. And there's the architect, there's the electrician, there's the plumber, there's the person who's going to lay the flooring down. All of them need to know what the other person is doing if you're going to have a fine house.
One of the things that we also know that's important, that we believe is important as part of interprofessional education, is that it builds a culture of shared leadership within a interdisciplinary healthcare professional team. And that's important because everyone has an important way of being able to contribute when they're working together as a team and delivering quality healthcare for a patient. Effective teams need people who not only take initiative, but those who are also comfortable learning from and following direction that's provided by others.
A central thing in a team is that you trust each other to respect what we each as individual professionals can do, and that we also trust the patient to make decisions. And so trust and encouragement and support in the good team, there's not a better working environment, for sure.
I like to believe that we're all in it for the same, which is to improve the health and well-being of our patients. If we all have the same goal here, then working closely together will realize that.
In the pilot project for interprofessional education, one of the first experiences for me actually seeing students in action, learning interprofessional education and collaborative skills. And we posed a case situation to those students, and they just ran with it, and they were excited to learn from one another and about one another.
I was so excited about the pilot that we did because the students were so excited. And I expected them to like it because I think that we all did great work together, but they really liked it.
It was very moving. It was moving to see people with such excitement kind of all focus on the welfare of this one patient. Social workers were trying to address the issue of the patient not being able to get to their doctor's appointment. There were nurses who were talking about how they could, in a visiting nurse visit, try to help the patient with organizing their medications. Dentists were talking about how if the patient's dentition was better, they probably would have an easier time chewing their food and not be at risk of aspiration pneumonia. Physical therapists were looking at non-pharmacological ways of addressing the patient's chronic knee arthritis. It was very moving, and I think we all looked at each other and said we wished that this would go on in real life.
Our results showed that they hope that we can integrate our education with interprofessional collaborative practice, and that is linking education to practice so that they can become competent practitioners in a team-based working environment.
What we want for our students is for them to get this requisite skill set of IPE and IPC that will allow them to become team members of healthcare of the future.
The interprofessional training here at UB helped me to understand that there's really no one professional that can manage the full gamut of patient care on their own. Now that I'm out practicing as a physical therapist, it's much easier for me to call on other colleagues in different settings or different professions in order to consult and come up with the best management for our patients.
I think it's really imperative that our students today, who are here at the University of Buffalo, are able to work with a variety of professions, something I didn't have when I was a student. I think it's imperative that they learn from each other, they learn about each other, and they work together to learn to help the clients.